what is it really like to get zapped by radiation daily for weeks? Will it hurt? How tired will you get? And how do you live your life while going to the hospital every day? You've gotten that boring educational video from the hospital or cancer center on what to expect, but you want to hear from a patient what it's like firsthand to experience it. In this video, I'm going to share with you my firsthand experience of what it was like going through pelvic radiation for stage 3 rectal cancer. My name is Jelena, and even though I had no family history of cancer and thought I was taking good care of my health, I was still diagnosed with stage 3 rectal cancer at the age of 34. 28 days of pelvic radiation and the oral chemotherapy Xeloda were the first step in my treatment. In this video, I'll just focus on the radiation part. And ladies, make sure you stay tuned until the end to hear about a side effect that nobody seems to warn you about. Before I started radiation, there were a few tests that I needed to go to first to prepare. As I mentioned in my previous video, there was a whole slew of tests that I had to undergo to help determine the stage of my cancer after it was found in a colonoscopy. I was also referred to an oncologist and had an appointment with him a little over a week after my diagnosis. Once all my tests were in and it was determined that the cancer had spread to nearby lymph nodes, which made me stage 3, I was referred to a radiation oncologist. The radiation oncologist happened to have a same-day appointment available, so we went in right away to see him. My husband and I ended up being at that initial appointment for over 2 hours. We started out by, I had a bunch of paperwork to fill out first, and then we went back to the exam room, and I had my vitals checked before the oncologist came in. He said that the EUS, which was the rectal ultrasound that I went in for a few days prior, measured the tumor from 4.5 centimeters in up to 15 centimeters into my rectum. For us Americans, that is over 4 inches. Here's a ruler. 4 inches is from here to here. That's wider than my hand. That is crazy. It sounds crazy that something that large was hanging out inside of me. After the physical exam, I got dressed and we went back to his office where we discussed the side effects that I would experience during radiation and also to look at the CT scans. I'm not a medical professional and had never looked at a CT scan before, so I had no idea what I was looking at and couldn't even really tell where the tumor was, even when he was pointing it out in the scans. He told us that this is a very straightforward cancer with very straightforward treatments for stage 3 patients. I asked him if I could get the best treatment there or if I needed to go elsewhere in the country because I have family all over near a lot of excellent hospital systems and would be willing to travel if I needed to get the best treatment. He said that he has oncology friends all across the country and if he thought that I could get better treatment elsewhere, he'd have no reservations recommending me to go elsewhere. But he said that I would get just as good a treatment there as anywhere else. So that was comforting to hear that I could get great treatment for my stage right here in town. He explained that over the next few days, I would go in for a mapping CT scan, and I would also come in for a virtual simulation of radiation before the actual first day of radiation. The next day I went in for that mapping CT scan to determine where exactly in my body the cancer was. Based on that scan, the radiation oncologist would map out where exactly the radiation would focus during my treatment, and that would take about 2 to 3 days. Then I would go in for the virtual simulation, also known as a VSIM or a dry run, to make sure that everything was lined up correctly before radiation treatment actually began. And sure enough, 3 days later, I was back at the office for my VSIM. When I was called back from the first waiting room, the nurse showed me the second waiting room that I would go to for my actual appointments. I even got my own special card with a barcode on it to beat myself past that first waiting room to the second one. I stuck a picture of my daughter, Mael, on the back side of it so she could be with me every day when I went to treatment. During the VSIM, I went down to the room where the machine was that would be radiating me. On the way down to the machine, they showed me the nurses station where they would be watching me during my radiation treatments. They obviously aren't allowed to be in the room with me while the radiation is actively going, so they have a station with all these monitors, which includes a feed of me so they can watch me and make sure that everything was okay while I was getting radiated. And it also had a CT scan of the areas that they were treating on me. The room with the radiation machine itself and the machine were much bigger than I was expecting. The nurses helped me onto the table and then had me pull my shorts and underwear down about halfway down my thighs, and they put a cloth over my butt while they helped to position me in the right spot on the table. Since I was face down on the table, I didn't really get to see what was happening, but I could feel that the table lifted up, and then it moved forward some, and then the arms of the machine itself started rotating around me to take x-rays. One of the nurses came back in and drew an outline of the treatment area on my right thigh side butt area, and then left. She then came back in and drew on my backside that treatment area. They gave me the option of keeping the marker X's with the little round pieces of tape on them, or I could get a permanent tattoo. I didn't want to have to worry about accidentally washing off the marker X's or the tape falling off, so I just opted for the tattoos. They came in with a needle that was full of ink, and they placed it in each of the dots and just kind of like a shot injected some ink into each of the 3 spots to give me the tattoos for positioning. After the VSIM, we sat down with a nurse to go over the side effects that I could expect while going through radiation. I was also scheduled for my daily radiation time slot, which was 3:30 p.m. Monday through Friday. We had been sent a 25-minute video on radiation therapy, and we had watched it before going in, so the nurse didn't really go over anything earth-shattering. One thing that I did learn was that within the first few weeks, the bleeding that I was experiencing when I was sitting on the toilet should stop. It was also casually mentioned that radiation treatment had the potential of putting me into early menopause. Potential is an understatement. Every colorectal cancer survivor that I have talked to that's comfortable discussing this has been put into menopause if they're a woman or can no longer have kids if they're a man. If you are even considering having kids anytime in the future, stop this freight train right now and see a family planning doctor or fertility doctor ASAP to discuss your options. We were not planning on having any additional kids, so once we mentioned that, the conversation on menopause and reproductive side effects kind of just ended. June 13th was my first day of treatment, exactly 3 weeks after the tumor was discovered in a colonoscopy. My parents, John, and Mael all came with me for that first day of treatment. They all came back with me to see the radiation machine and what the room looked like, snapped this gorgeous picture of me standing in front of the machine, and then they went back to the waiting room while I hopped onto the table to get ready. As I mentioned earlier, I had to lie face down for treatment and pull my shorts and underwear down to my knees. The nurses would lay a towel over my butt so it wasn't hanging out the whole time. But they would also tape my butt cheeks apart so that there wouldn't be any folds that the radiation could build up in and cause even worse burns. Back to that gorgeous picture of me in front of the radiation machine. Once the actual radiation therapy is about to begin, that table, it rises up and it slides a little closer to the machine. Then the machine moves into position and buzzes for about 15 seconds. It does that in this position you see in the picture. Then it rotated and buzzed me on the left and then on the right side, and then I was finished. Here's a picture highlighting the areas that were going to be treated with radiation. My appointments were scheduled for 15 minutes, but most of that appointment time was spent adjusting me and making sure that I was in exactly the right position so that they weren't accidentally radiating the wrong parts of my body. Every Tuesday was Dr. Tuesday, so all radiation oncology patients would meet with the doctor after their treatment. So on day 2 of radiation, after I was zapped, I met with my radiation oncologist for a visit. He said he looked at the MRI results from the scan I went in the day before, and it looked like the tumor was actually 7 centimeters in from my anus and not 4 centimeters, so sphincter preservation had a much greater chance of happening now, which was great news. He said he still needed to go over the results with the radiologist, but the scan was looking promising. Otherwise, it was a really quick visit because I had just started radiation the day before, so side effects hadn't really started to settle in yet. Later that day, I thought it would be funny if I bought some markers and wrote some new message on my butt every day so that when I went into treatment and the techs lowered the towel, they would find a new surprise. Then, after I thought about it a little more, I got to thinking that my butt was probably going to be pretty raw by the end of treatment and would not be happy with me having to scrub marker off it every day. And maybe I should just do it on Fridays, and then that would give me the entire weekend to wash it off. I obviously can't show you those pictures, but I can tell you what John wrote on my butt every Friday. Of course, he got the job of writing these messages because do you know how hard it is to try and write something on your own butt? Not easy. So, here are the messages that he wrote each week. Cancer killer. This stinks. Danger. Exhaust. TGIF. And for my last treatment, kiss this sweet ass goodbye. The Friday before the 4th of July, John had left early to go to North Carolina for my sister's wedding, so I only had Maelle as my assistant, and so I had her put some patriotic temporary tattoos on my butt. 3 days into treatment, and my insides were already in turmoil. After eating breakfast, I suddenly got horrible abdominal cramps and rushed to the bathroom. I thought that I might just need to poop or let out some gas, but once I got to the toilet, it hurt so bad I couldn't even try to push anything out. And then I started to black out. Thankfully, I didn't completely pass out, and eventually the pain let up a bit so I could go to the bathroom, but I had to lie on the couch for a few minutes afterwards because it still hurt a decent amount. I was also feeling really tired already and taking daily naps, which was really unusual for me. I am usually not a napper. Even when Maelle was a baby, I would not nap. So the fact that I was taking naps daily meant that treatment was really taking a number on me. After finishing the first week of treatment, I didn't have any more episodes where I almost passed out on the toilet. But I was still passing blood when I was passing gas and stool. My insides felt a little off, but not enough to affect my eating habits or really cause any pain. I did lose 2 pounds that first week though, so I decided to try and focus more on eating throughout the day. My appetite wasn't as strong, but I wasn't experiencing any nausea yet. Week 2, I started experiencing some back pain, and by the end of the week, it was waking me up in the middle of the night. The pain was so much. My left butt cheek started hurting a lot too. So I called the radiation oncologist's office to see if it was okay to take anything for the pain. And they said that it was fine to take ibuprofen. So I took 3 of them. And it did help my back pain, but it didn't really help the pain in my butt cheek. I was also just starting to feel really stiff all over. So I tried to make sure that I was taking walks daily to try and loosen things up a little bit. I also started getting really bad cramps in my insides that I would just have to ride out on the couch for the afternoon and half of the evening. Week 2 was also when my appetite really started to decrease. By the end of the week, I had an almost constant feeling that I needed to go to the bathroom. But when I sat on it and tried to push anything out, only blood came out. My pain was rotating from cramps to gas pain to feeling like I needed to poop to just my rectum feeling sore. The sore rectum was pretty much a constant feeling, but the other ones kind of rotated. Sometimes they would last just a couple minutes, other times like an hour or so. The pain was tolerable. It was usually only like a 2 to 3 on that scale of 1 to 10, but I would occasionally have some spikes of up to a 6 on the pain scale for a few minutes at a time. I had some urgent bathroom visits too, where I got a sudden onset of really bad cramps, and as I was rushing to the bathroom, it just felt like my insides wanted to fall out. The diarrhea started at about this time too, but it wasn't for every bathroom visit yet. Overall, though, I wasn't happy with how I was feeling by the end of week 2 and was not looking forward to another 4 weeks of this. Week 3, my body was maybe starting to adjust to the treatment, or maybe I was just getting used to the feeling of my insides feeling like they were in turmoil. I was going back and forth between being constipated and having diarrhea. My rectum felt like it was constantly sore, and I felt like I needed to go to the bathroom all the time. I feel like the tumor was tricking my rectum into thinking that it was partially full and that I needed to go to the bathroom all the time, but most of the time when I would go and try to push something out, all that would come out was blood. During my weekly appointment with the radiation oncologist, I mentioned all of this to him, and he said that there was a steroid suppository that he could prescribe if I felt like I needed it. I kind of wanted to wait it out and see if things got worse before getting it, so he said if I changed my mind before the following week, I could just call the office and they would call that prescription in right away for me. Throughout the rest of treatment, my insides just felt really unsettled. I was a runner and I tried to keep running throughout treatment, but I kept getting slower and slower each day, and eventually I had to stop because the pain in my rectum got to be too much. I was also plagued with a lot of gas and gas pains, which made it really difficult to continue running because I also was still passing blood every time that I passed gas. On my last treatment day, I got to ring the bell at the cancer center to signify that I was all done with radiation.
3 times? 3 times.
The taping of my butt cheeks must have helped. Something I never imagined I would be saying, especially on YouTube, but it must have helped because I only had slight burns on my butt after the 28 days of radiation. Inside of me, though, was a different story. The burns inside of my rectum made it feel like there were spikes that were inside, and any kind of movement, even just walking, felt like those spikes were stabbing me constantly. I was prescribed SSD cream to put on the visible burns on the outside, and I also used Dermaplast spray for some pain relief. For the inside burning, I just used over-the-counter hemorrhoid suppositories. Even using all 3 of those combined, I spent a lot of time face down on my bed with my raw butt just open, airing out, because it hurt to even have any clothing touching it. If you've gone through radiation treatment yourself, let me know in the comments below what you used to help relieve the burning. About 2 weeks after radiation finished was when my body finally felt like it was healing and not getting any worse. That's also when that spiky feeling in my rectum started going away. One thing I learned is that you need to ask for that SSD cream right away as soon as you start to see burns forming, because they're just going to continue to get worse even after treatment ends. The Dermaplast was awesome too for some quick pain relief, and the spray was really nice because you didn't have to rub it in on the already tender areas. And now for the final side effect that all women need to know about, but I had to learn about from other survivors. When you're receiving radiation, it's also hitting other reproductive parts, including your vagina. Scar tissue can form, causing the healthy tissue to become less elastic, and it can also narrow and shorten the tissue. To try to mitigate lifelong complications from this, you need to use vaginal dilators or have sexual intercourse twice a week for the rest of your life. This needs to start 4 weeks after you finish radiation. No one at the radiation oncologist's office mentioned this to me at all. But when I called the office to ask for the dilators, they were like, "Oh, yeah, you need to use these twice a week forever." They gave me 3 sizes to use so I could start out with a small one and work my way up to larger ones. They were pretty painful to use at the beginning and made me bleed a little bit, but the more I used them, the more the tissue stretched back out. So please be sure to ask your doctor about this if you have to undergo radiation treatment. I was really nervous and a bit afraid to ask the doctor about this, but this is a life-altering thing to deal with if you don't ask. And it was just a nurse that I talked to on the phone. I didn't even have to talk with the male radiation oncologist. So please be sure to ask your radiation office about this if you're undergoing pelvic radiation. To hear more about what you can expect during the rest of your treatment, you can click on that playlist right over here. And if you're currently suffering through radiation treatment, I'm sending you a big hug because I know how rough it is. Thanks for watching.